The ARC is a community-based organization with over 600 state and local chapters across the United States. The ARC was founded in 1950 and has been serving people with intellectual and developmental disabilities for nearly 75 years. The ARC serves people with disabilities in several public policy arenas such as civil rights, employment, healthcare, education, and more. The ARC's mission is to promote and protect the human rights of people with intellectual and developmental disabilities by actively supporting their full inclusion and participation in the community throughout their lifetimes. They are guided by 8 core values of human dignity, personhood, choice, rights, community, support, equity, and diversity. The ARC organization has a complex system of authorities who keep the organization running smoothly. These include 6 officers, 17 directors, CEO Catty Nees, and COO Ruben Rodriguez. Additionally, there are 6 specified teams that keep the ARC's countless programs running. Because the ARC organization advocates for public policy change, local and federal government officials are also considered key authorities. The ARC organization is supported by more than 80 corporations, advocacy groups, foundations, federal agencies, and universities across the United States. Throughout their 75 years of operation, they have created meaningful change for many communities and formed powerful relationships who help keep the ARC's many programs running. The ARC has many key constituents and stakeholders. These include the ARC national headquarters, state chapters, local chapters, members, people with disabilities themselves, as well as their families and caregivers, staff, volunteers, and funding partners. The ARC faces 5 major challenges to successful disability advocacy. These include securing adequate funding to be spread across national, state, and local branches, breaking down systemic barriers such as stigma in the education system, the slow and difficult task of making legislative change, adequately supporting people with disabilities in areas where services and professionals are limited, and building and keeping public interest. The ARC utilizes 4 key strategies to make their disability advocacy successful. These include utilizing their 600-plus chapters to facilitate disability services in areas which lack them, advocating for inclusive policy change at the federal, state, and local government levels, spreading awareness through partnerships with companies, foundations, and more, and educating and empowering people with disabilities themselves to self-advocate for the support they need. The ARC has very effective communication. Their website is their best asset for information, and their advocacy work and policy positions are clearly outlined for anyone to use. The ARC is also active on Facebook with over 100,000 followers. Additionally, the ARC uses Instagram, reaching 5,000 followers. There, they post infographics, testimonials, and more. Highlighted are 3 communication challenges the ARC organization faces. Semantically, the ARC must adapt to keep up with the most appropriate disability terminology. Philosophically, the ARC must weigh how to be both inclusive of and give specialized care to those with disabilities. On a practical level, the ARC works with complex agencies such as the federal government to make change. This is a slow and difficult process. 2 communication opportunities for the ARC are their Instagram utilization and planning for an aging population. The ARC has over 100,000 followers on Facebook, but only 5,000 on Instagram. Younger social media users tend to use Instagram over Facebook, so this will help gain more public awareness as well. Additionally, medical technology allows for people to live longer than ever. The ARC should plan for communicating with elderly people with disabilities more often in their future. Currently, the ARC organization is only active on Facebook, but less so on valuable social media platforms such as Instagram and TikTok. A communication innovation for the ARC would be to collaborate with disabled and non-disabled social media influencers who will keep the ARC current with the times, increase engagement with younger generations, increase viewership, and build trust and curiosity with new communities.